So today we're gonna talk about OSHE. What is OSHE? OSHE stands for Occupational Safety, Health and Environment. It is also referred to Occupational Safety and Health, OSH, and Workplace Health and Safety, WHS. Occupational Safety and Health, OSH, is a multidisciplinary field concerned with the safety, health and welfare of people that engage in the work or employment. The goal is to foster a safety and healthy environment in the workplace. The main three objectives of this practice are the maintenance and promotion of workers' health and working capacity, to improve a working environment and work to become conducive to the safety and health, development of work organizations and working culture at a direction which support health and safety at work. This practice actually holds an act that is known as Occupational Safety and Health 1994. The background history of this practice is the way of government's effort to control the occurrence of accidents and occupational disease in the country. It shows the concern in protecting the safety and health of the workers and employers. It is very important for all organizations to reduce or eliminate workplace hazard. Hazard can be classified as a thing that have potential to cause an accident. It is important to evaluate the standard of risk and to control the hazard from becoming an accident. People who might be affected by the workplace environment, such as family members and customers, are also protected by OSH. OSH practice is related to the preventative, punitive, and compensatory effect of law that protect workers' safety and health, also diminish the employee injury and illness-related costs such as medical care, sick leave, and disability benefit costs. The benefits of this practice are to help companies create a workplace safety practice that prevent injury or death, reducing lawsuit risk, and helping recruit and employ more qualified employees. American crowbar case is an example of an accident that can occur in the construction site. Phineas Gage was the greatest survivor in the history.
Strong and durable fellow started working on the railroads in his 20s and soon became a blasting foreman. The railroads, of course, met with resistance in the form of nature, and sometimes rocks needed to be blasted away. To do this, you packed them with explosives, but the packing itself was a hard job. To do that, you usually bore a deep hole in the rock and filled it with explosives. Once you had drilled the hole, you then put in the dynamite. But to make sure you really destroyed the rock from inside out, you then had to pack other materials, often clay or sand, firmly into the hole. To do this, the tool of choice was a tamping iron, which is basically an iron rod. On the fateful day of September 13, 1848, this was the job of Phineas Gage when working on destroying rocks near Cavendish in Vermont. As the story goes, Gage was looking behind him where men were working. As he was about to speak, his tamping iron hit the rock, causing a spark. The explosives went off, and that tamping iron set off like a rocket in the direction. The tamping iron went up through his jaw, past his cheekbone, behind his left eye, through the left side of his brain, and out the top of his skull.
Safety on the job is no accident. Occupational health and safety specialists and technicians keep workplaces as accident-free as possible by looking for safer, healthier, and more efficient work practices. Occupational health and safety specialists inspect workplaces to ensure they meet safety and environmental regulations. They examine factors such as lighting, ventilation, and whether materials are stored or disposed of correctly. Occupational health and safety technicians work with specialists to conduct tests and measure hazards. They may perform checks to make sure workers are using required protective gear, such as masks and hard hats. After a workplace accident or injury occurs, occupational health and safety specialists and technicians investigate potential causes and plan how to prevent future events. They may develop training programs to correct risky conditions and coordinate rehabilitation for injured employees. Occupational health and safety specialists and technicians generally work full-time and travel from their offices or factories to conduct field work. They use gloves, respirators, and other gear to minimize exposure to hazards. In emergencies, they work weekends and irregular hours. Occupational health and safety specialists typically need a bachelor's degree in occupational health and safety or a related field, while technicians typically enter the field through on-the-job training or a related associate's degree or certificate.
It was a responsibility of all employers and workers to understand the practice and policies to prevent an accident caused by unawareness and carelessness. In a conclusion, this shows that OSH practice is indeed really in need for companies, employers, and workers to take it as a serious matter to prevent any harm, risks, hazard, and potential thing that can cause an accident. In the future, I hope this practice can actually be participated by a lot of people and take your life as a serious matter, as we, who is an engineer, is more exposed to the harm at the construction.